Hi, so today I will be demonstrating how to perform a nasal and oral specimen collection. First, I will demonstrate an anterior nares nasal swab. So to begin, you're going to start by preparing the necessary supplies for specimen collection. So in this case today, that is a sterile cotton swab. From there, we want to ensure that we have the proper PPE. Since I will be demonstrating on myself today, I do not have any PPE with me. Then your next step is that you want to evaluate the patient. You want to ask the patient, have you had any surgery on your nasal passage recently? If they have not, you can continue, and you want to let them know what to expect. So I would say something along the lines of, I'm going to insert the swab inside one of your nostrils to collect the specimen for testing. This may be uncomfortable and you may feel some pressure. Then I will want to go and sanitize my hands or wash them thoroughly with soap and warm water. I already sanitized my hands prior to starting to record this video, so I will not show how to do that in the video. The next step is to position the patient in a manner that makes it easy to collect the specimen. So what this looks like is making sure that their nostrils are about eye level to you, making sure that their head is straight on, and you can encourage them to close their eyes. Then you want to discreetly look at the patient's nose to see if it deviates in one direction, or just to see the general direction of the nasal passage. If there is a feature that will make it difficult to obtain the sample in one nostril, you want to use the other nostril for collecting the specimen. After you do all that, it will be time to collect the specimen. So to do so, you're going to use your dominant hand. You'll want to hold the nasal swab between your thumb and your forefingers. And then you will insert the swab at least half an inch inside the nostril, leave it in place for about 10 to 15 seconds while rotating it against the nasal membrane. Then using the same swab, you're going to repeat this step in the other nostril. Once you're finished, you're going to place the swab into the transport media and store it appropriately. I will demonstrate how to do this now. And that is how you would collect a nasal specimen. So next, we are going to go over how to perform a buccal or an oral fluid collection. This process is very similar to collecting the nasal specimen. So again, we're going to start by collecting our materials and making sure we have everything. So again, this is similar. Same thing, we're going to have a sterile cotton swab. Next, we're going to obtain the proper PPE, and as I mentioned earlier, I don't have any PPE with me today. You will then want to evaluate the patient. You want to ask them if they have had anything to eat or drink in the past 30 minutes, if they have used any nicotine products in the past 30 minutes, or if they have brushed their teeth or have used any mouthwash in the past 3 hours. If they answer yes to any of these questions, then you want to advise them to wait to do the test because it may affect the results. Next, you want to let the patient know what to expect. So you can tell them that I'm going to insert the swab inside your mouth and collect a sample from your cheeks. It should not be uncomfortable. After that, you'll want to sanitize your hands, followed by positioning the patient in a manner that allows for easy access to collect the specimen. This is making sure that their mouth is about eye level to you, and then also telling them to look straight on, and you can encourage them to close their eyes. Additionally, encourage them to sit still. So then once you do all that, you will use your dominant hand and insert the swab into the mouth and preferably rub up and down against the inside of the cheek for about 5 to 10 seconds. You're going to repeat this on the other side of the cheek by swabbing it for 5 to 10 seconds. When you remove the swab from the mouth, it's important to try to avoid touching the lips or the teeth or any other surface. Once you're finished, you're going to place the swab inside the transport media and store appropriately. I will demonstrate the swabbing technique now. If I could open it. Give me a second. And that is how you would perform an oral specimen collection and how you would perform a nasal specimen collection. What questions do you have for me?